Having poor shoulder mobility can impact nearly every aspect of your life. It can be painful, and if you're trying to train for any amount of performance, can severely limit the exercises you can use. In this video, we will provide exercises and drills to help with your flexibility, strength, and general posture, along with some ways to implement those into your training. What helps you the most will depend on what areas you need the most work in. The one thing everybody should do is hang a few times per week. You just want to relax in this position and let your shoulders fully extend. I like having one day of 3 to 4 sets of max hangs and then sprinkling it in for 1 or 2 sets, not of max duration, but just as more of a stretch on some warm-up days or just after your workout. As a bonus, hanging is really good for your grip strength and decompressing your spine. However, if your shoulders are sufficiently locked up or you lack the strength to do a full hang, using partial hangs is a great way to go about this. If you lack the strength to hold yourself up, then utilizing a lat pull-down machine probably works the best. Load the weight up to something that you can hold for between 30 seconds and a minute and just relax. Let the weight pull your shoulders upward. If strength isn't the issue, but your shoulders just feel really locked up and you can't really get into that full relaxed hang position without pain, then changing the angle and setting something up with a band or cable machine like I have here is probably going to be your best option. Let the band pull your shoulder. Slowly add tension and duration as your shoulders feel better. If you can, use a wrist strap like I am, which promotes better relaxation. But if not, holding onto a handle can work as well. Before covering the drills for flexibility, strength, and posture, take this reminder that this video is not meant to fix serious injuries, but is a means to help develop reasonable strength and flexibility in your shoulders. If you are recovering from or suffering from a known injury, consult your orthopedic or physical therapist before jumping into any new exercises. Outside of hangs, here are a few of my favorite mobility drills for the shoulders. The wall chest stretch just has us place our forearm against a wall or a squat rack like this, and then all we're going to do is turn our body slightly in the opposite direction and push our weight a little bit forward so we get a nice stretch here throughout the chest. We should not really be feeling this in the shoulder, but more in the chest area and really feel that pull apart. You might need to adjust how far you rotate, your exact position, how far or hard you lean forward, depending on where you feel it, so we can get that tension mostly in the chest. I recommend holding this for at least 20 seconds on each side, and longer is probably a little better. Another great stretch is the shoulder across your chest, where we are just going to grab our wrist and lightly pull across, feeling this stretch in the side and back of our shoulder. We want to start pulling pretty gently at first, and then as the stretch goes on, we can pull a little bit harder and increase the intensity. Deficit push-ups are another great exercise to include in your warm-up or even in your actual workout. Start with as small a deficit as you can handle and slowly increase that over time. If you need to, you can go to a knee if strength is an issue, or as you get stronger, add weight. In general, using a full range of motion will help improve mobility. However, going through deeper positions like in the deficit push-up can take that to the next level. Just make sure, like with all of these, you go slow and do proper progressions. If something is causing discomfort, scale it back by using less weight, less range of motion, or changing the angle like we did with the partial hang. Another type of stretching that can also build some strength is fighting positions as long as it isn't causing pain. This banded rotator cuff exercise works great. Use a fairly light band so there is some tension, but weight isn't the issue. Then go back as far as you can and fight the position. Keep the elbow stable and go back until you hit your wall. I have healthy mobile shoulders, so I can get to the full upright position, but I've worked with powerlifters, for example, who just couldn't get very far. Their shoulder didn't move. Spend time in the furthest position you can manage. Pull back until you meet your wall and fight against it for about a second. Then do some more reps. Now, if that's causing pain, don't continue fighting, but if it's just hard to get to or feeling a little blocked, then you can likely use this method without much discomfort. Another version of this is just to stand upright and try and pull your hands back as far as you can. I have worked with people who they could only get to about here before they started meeting their block. Over time, as you're fighting against that, without pain of course, you're going to eventually be able to get further and further back, and you're going to have a much larger range of motion in your shoulders. Now sometimes the upper back is tight, and getting some movement there will help the shoulders. Rolling out your T-spine or upper back on a pipe or foam roller can do wonders. You can also progress to raising your hands above your head or even doing T-spine sit-ups, where you keep your ribs locked down and just try to move that upper back around your roller. Once you are able to get into good positions, you must strengthen the muscles of the upper back and shoulder. My first exercise up is the scapular retraction. Get on a pull-up bar or use a lat pull down if you're not strong enough for your body weight, and focus on just pulling down your shoulders. Get control over the muscles in your upper back and shoulders. This can be great to do as a warm-up prior to pull-ups or pull-downs to get those muscles muscles activated. This is how all pull-ups or pull-downs should start off, so once you get good at this, just leave it to your main pulling work to maintain this ability. A staple in training for healthy shoulders is the face pull. Do these for higher reps, like 15 plus, and really focus on the tension in this back position. Stopping short isn't going to help you here. Pull as far back as you can while holding the chest up and squeeze those upper back muscles. You can also add in some external rotations, starting with your hands in front and then rotating on your way back to get to that same position. Try both and see what you like the most. To hit the lateral deltoid or muscle along the side of your shoulder, the lateral raise is our go-to. You simply stand straight and tall with your arms at your side and slightly bent. Then, without bending your arms anymore, raise your arms until your hand is at least at shoulder level or slightly higher. Control the weight on the way back down and focus on feeling the tension in the sides of your shoulders. These should be done for moderate to high reps, like 20 to 30. If you are experiencing shoulder pain, go towards the higher end to promote blood flow and less stress on the joint. For the posterior deltoid or muscle in the back of your shoulder, we can do a band pull apart. Stand tall with the arms in front of you and slightly bent. Then, without bending the arms more, pull the band in a big arc backwards. Think about your hands moving in opposite directions along a big circle. Focus on feeling this tension in the back of the shoulder and control it back to the start position. I would also keep these in the 15 to 30 rep range, at least for your first set. We did a banded version of a rotator cuff exercise in the flexibility portion that you can use banded or with dumbbells for strength once you can get into the position. There are countless other exercises for your rotator cuffs, posterior delts, lateral delts, and upper back. Just make sure that you go through the full range of motion and focus on using the muscles you are supposed to feel. Go slow and controlled, as these small muscles in the shoulders can often be pushed aside by the bigger traps and rhomboids if you're just trying to move the most weight and not really focusing on doing it correctly. Lastly, let's discuss general posture. Pay attention to how you sit and where you are looking. Keep your head up, chest up, and shoulders back as often as you can. All the stuff in the gym won't do crap if you spend the next 12 hours with your head down and hunched over. If your job demands doing that, then extra time and energy needs paid attention to this in the gym. It would be a good idea to do some upper back and shoulder work before you start work, and then again when you are done, with 1 to 2 more intense sessions during the week to build strength and mobility there. I consider neck training as part of general posture, although you could easily place it in the flexibility or strength group as well. I will demonstrate the bench neck workout, which the goal should be 2 minutes of continuous controlled motion. I will also link a full video on neck training that details out some weighted training if you're interested. Lay down on a bench with just your head hanging off. Then go through all 4 of these positions. Down the whole way, back up, trying to touch your chin to your chest, then back to neutral, and then turning to the right and to the left. Go under control, nice and slow, and make sure you are going through the full range of motion. We want both strength and flexibility. When you can maintain doing this for at least 2 minutes, you can add weight. Now, how do you actually apply all of this information to your program? This will depend a little on how severe your lack of shoulder mobility and strength are, and which one is your limiting factor. Some people are going to be really strong but have trouble getting into positions, and others have fine mobility but lack strength. The first thing will be to, as much as possible, stop the things that are bothering you. If those are specific exercises, or even your sport if it's the off season and you're trying to heal. In season, you're gonna have to do what you can. If one of these exercises is bothering you, stop it, or try regressing it by decreasing the range of motion or intensity until it doesn't, and then slowly progress that over time. The recommendations I am going to give are a baseline starting point if you're trying to improve your shoulder mobility and strength. If you have no problems but just want to avoid issues in the future, then you can likely do just each strength exercise once a week for 3 to 4 hard sets and some mobility work after your upper body lifts. I will likely do a full video for athletes on what some good standards to reach for shoulder health are. This video's purpose is more for getting your shoulders healthy and reasonably capable, more so than improving or preventing issues with already healthy shoulders. I would hang or do partial hangs at least 3 times a week. One of those days would be 3 to 4 sets of max hangs, and the other day could be like 1 set before the workout and 1 set after. These don't have to be for a max hold, just to get a good stretch in. If you want to do more, do some of the partial hangs banded with the strap around your wrist so you don't tax the forearms and elbows anymore. The other mobility drills you can do 3 to 5 times a week as well, depending on how they feel. Focus on holding positions for 20 plus seconds and try to hold longer and deeper over time. If using deficit push-ups as an actual workout, start with 2 to 3 sets 1 day a week and steadily increase as you're able and not feeling sore. They can be done during all upper body day warm-ups if not pushed too hard. For the strength exercises, I would start with 3 to 4 sets 2 times a week on each portion of the shoulder. We could say lateral raises for the lateral deltoid, pull aparts for the posterior deltoid, external rotations for the rotator cuff, face pulls for the upper back and scapular retraction until you've mastered that, and then you can just do that on your lat pull downs or pull ups. I would do the bench neck workout similar to hangs. At least one day should be 3 to 4 hard sets, and then another 2 to 3 days can be more moderate intensity just to stretch out and feel those positions. Of course, always try to maintain good posture with your chest up and head neutral. As far as fitting these into your workouts, they aren't taxing, so they can really go anywhere. I typically would just do 1 to 2 exercises for strength at the end of upper body workouts, and then some of the mobility work. The mobility stuff can also be great before training too, as it gets you ready for those positions. Another tactic that I often use is doing them supersetted with non-related lifts. We will often do like squats and then hangs or bench neck as part of the squats rest. This allows for more rest on the squat workout without just sitting there doing nothing. Since these are all fairly simple, non-taxing movements, fit them in wherever you have time and availability. The important thing is you get them done and focus on improving over time. If you have any other questions on these recommendations or about specific shoulder issues, please let me know in the comments. And this video certainly doesn't cover everything, but to me is the most practical and usable advice that will work for the most people. If there are any other body parts or issues that you want addressed, also let me know in the comments. Share this video with anyone who needs their shoulders cleaned up, and please subscribe to improve your sports performance.